Hello and welcome. This video will help you prepare to manage and care for your tracheostomy at home. In addition to this video, your nurse will teach you about your tracheostomy and how to care for it. Please be sure to read the patient guide, Tracheostomy Care at Home. A tracheostomy is a small surgical incision that creates an opening into the trachea or windpipe. The opening is called a stoma. Normally, air enters the mouth and nose, travels past the larynx, vocal cords, through the trachea or windpipe, and then travels to the lungs. When the air is exhaled, it travels back the same path up through the vocal cords. The air vibrates the vocal cords to produce speech. A tracheostomy is done when swelling from surgery makes it difficult to breathe with or without reconstruction. A tumor obstructs breathing, a vocal cord problem occurs, an injury affects breathing, surgery involves bulky reconstruction, respiratory problems occur as a result of surgery, or a breathing tube is needed for an extended time while on a ventilator. Sometimes a tracheostomy is done as part of a planned major surgery. It is a safety measure should swelling or bleeding occur after surgery. Other times, it may be done on a more urgent basis, such as when a patient is in distress due to a blockage or decrease in vocal cord function. A tracheostomy allows air to now enter through the opening in the neck, through the trach tube, and directly to the trachea and lungs. When the air is exhaled, it travels back from the lungs and exits the trachea and the trach tube. This allows air to bypass any blockage or obstruction above the tube. A trach tube provides another way for you to breathe. The inserted trach tube is secured with either sutures or trach ties that hold the tube in place. The tube is usually made of plastic, but some are made of metal. Home care is the same for both. After the tracheostomy procedure, you'll breathe mainly through the trach tube. This means that air is not warm, filtered, or moisturized. Also, mucus from your lungs is usually forced out through your mouth and nose when you cough. Mucus may become dry and difficult to cough up when you cough through your trach tube. Daily tracheostomy care needs to be done to help manage this mucus. This involves using saline to put moisture in the tube and use a suction machine to suction the trach tube regularly. It helps remove mucus that you cannot get rid of with coughing. You will go home with a suction machine and written instructions on how to loosen and suction the mucus. The trach tube changes the way you communicate. It redirects airflow through the trach tube in your neck to your lungs instead of the voice box, nose, and mouth. Most of the air is exhaled through the tube and does not travel up the vocal cords. This makes it difficult to speak. Although a small amount of air may pass through your vocal cords, you often cannot speak right after the procedure. Some patients choose to write instead. As the swelling goes down, you may be able to cover the end of your trach tube with your finger and redirect the air through the vocal cords and out the nose and mouth to produce sound instead of the air exiting the tube. This is called using finger occlusion to speak. A speech pathologist can work with you to increase communication skills and show you how to use tools for hands-free speech, such as a speaking valve. The Passimir valve is an example of a speaking valve that is placed on the end of the trach tube to help you talk. A trach tube has 4 parts: the outer cannula, the inner cannula, the obturator, and the cap. The Passimir valve is an optional and separate piece provided by speech pathology. The outer cannula is the tube that stays in your neck. It should always be secured with trach ties or sutures. The outer cannula should only be removed by a medical professional. The inner cannula is the tube you remove and clean. Insert the inner cannula into the outer cannula, and once the inner cannula is in the correct position, it will click into place. The inner cannula should always be in the outer cannula and removed only for cleaning. The obturator is the rounded end piece. Should the trach tube come out accidentally, insert the obturator into the outer cannula to replace the trach tube into the stoma. The tracheostomy cap has a red end on it that sticks out from the outer cannula. It's used to determine if the trach tube is ready to be removed. The cap blocks airflow through the trach tube so you breathe through your nose and mouth. It can be removed at any time and replaced with the inner cannula, especially if you feel short of breath. It is important to make sure that the inner cannula is always in place when the outer cannula is inserted. If breathing is uncomfortable with the inner cannula in place, then you need to talk with your doctor about the size of your trach tube. There are numbers and letters on the front of the trach tube. These indicate the size based on the diameter and length of the opening. Your doctor will determine which size is best for you based on your needs. The common sizes are 4, 6, or 8. The letters on the tube indicate whether the trach tube has a cuff or not. A cuffed tube has a balloon around it that inflates to create a seal and allows the use of a ventilator. Most patients start off with a cuffed trach tube after surgery. You will then transition to a cuffless trach tube once it is safe to change it and you are ready for a trach tube change. Before you leave the hospital, we will provide you with the equipment and supplies to use at home. This includes a suction machine to remove mucus from your tube and your trachea. You must have a portable suction machine before you go home. A suction catheter, a set of tubing that hooks to the suction machine. The tubing is passed through the trach tube and down the trachea to help remove mucus. A spare trach tube in case yours breaks or gets lost. Trach ties to use around your neck to secure the tube and keep it in the stoma. Drain gauze sponges to place around the trach tube if you have a small amount of blood or mucus. A brush to clean the inner cannula and remove mucus, and saline ampules. You'll put saline through the tube to moisten the air you breathe and loosen the mucus. While the trach tube is in place, clean the skin using a cotton tip swab and saline. If mucus gets stuck on the skin around the trach tube, use a small amount of diluted hydrogen peroxide on the skin to help loosen it. You will need to perform trach tube care daily, up to 3 times a day. You will use a suction machine to remove mucus, clean the skin around the opening, remove the inner cannula of the trach tube and clean it with a brush, then reinsert the inner cannula. Squeeze the saline ampule into the tube. The saline moistens the air you breathe through the tube and loosens the mucus. Change the trach ties that hold the trach tube in the neck every 1 to 2 days or when dirty. To suction your trach tube, follow these steps. Gather your equipment, the suction machine, the suction catheter, and a container of water. You may need a mirror if you do the suction yourself. Wash your hands. Connect the suction catheter to the suction machine and turn the suction machine on. Follow the suction machine instructions that you received from the equipment company and make sure that the amount of suction is set to the correct pressure. Without using suction, insert the catheter about 4 to 5 inches into the trach tube until resistance is met or you cough. Do not force the catheter into the inner cannula. Pull the catheter out about a ½ inch. Apply suction by placing your thumb over the vent. Slowly pull the catheter out while rolling it between your fingers and coughing. This will help remove the mucus. Suction for only a few seconds. Remove the suction catheter from the trach tube. Rest and take several breaths before you suction again. If the mucus is in the catheter after you suction, dip the catheter into the container of water and apply suction. This allows the water to clear the mucus from the catheter. When you are done, clear the tubing with the water and turn off the machine. Your equipment provider will give you instructions on how to use and store the suction catheters and machine. Call the equipment provider if you have any problems with the suction machine. Place a new gauze dressing under the tube as needed. Do not put gauze if you did not originally have gauze with your trach tube. Change the trach ties that hold the trach tube in the neck every 1 to 2 days or when dirty. To clean your tracheostomy equipment, follow these steps. Gather your equipment, tracheostomy brush, liquid soap, cool water, cotton tip swabs, hydrogen peroxide, trach ties, 4x4 gauze, and a mirror. Wash your hands. Remove any gauze around the trach tube. If there is a speaking valve attached to the end of the trach tube, remove it. Unlock the inner cannula and remove it. Wash it under cool running water with a small amount of liquid soap. Use the brush to clean the inside of the tube. When you are done cleaning the tube, rinse it with water and shake excess water from the tube. Dry it off with a paper towel. Insert the inner cannula back into the outer cannula in the neck until it clicks into place. Dip cotton swabs in diluted hydrogen peroxide to clean the neck skin around the trach tube. Use several swabs to clean the neck skin. Use a dry swab to dry the area. Change the trach ties every 1 to 2 days or when dirty. Hold the trach tube securely in place. Remove the dirty trach ties and throw them away. Then replace it with the clean trach ties the same way you removed it. Fasten the Velcro to the trach ties on the side of your neck to make sure that it is secure but comfortable. You should be able to place only 2 fingers between your skin and the collar. Next, place the pre-cut 4x4 gauze or drain sponge under the tube if needed. Throw away any items you cannot reuse. Store your equipment and wash your hands. It is important that you add moisture to the air you breathe. This can be done with a humidifier, which is a machine placed at the bedside to provide cool, moist mist, or saline ampules to squeeze normal saline into the trach tube. Ask your doctor or nurse about both of these options. To instill saline into the trach tube, follow these steps. Ask someone to help you or do this in front of a mirror. Gather your supplies: suction machine, suction catheter, saline ampules, and tissue. Take 2 deep breaths and exhale after each breath. Take another deep breath, hold it, and then squeeze a portion or all of the saline ampule into the trach tube. This usually causes you to cough and moistens the mucus to help you get rid of it. Keep a tissue in your hand so that you can cover your tube as you cough. If you do not cough up the saline easily, use your suction machine to help clear the mucus. 1 saline ampule at a time is usually all you need. Do these steps 3 times a day or more often if needed. There are some situations that require urgent attention. First, stay calm and get help. Call 911 or go to the emergency room right away with your trach tube. If you start to bleed from or around the trach tube and it does not stop within 10 minutes, you have difficulty breathing, if your trach tube comes out and you cannot reinsert it after 3 attempts, you cannot pass your suction catheter through the trach tube, or you have a fever of more than 101. In your guide, please refer to the information, what to do if you have a mucus plug, your trach tube comes out, you have signs and symptoms of an infection, you have bleeding from or around your trach tube, you have granulation tissue, or you are alone at home. Before you leave the hospital, you and your caregiver will need to show your nurse that you can do your tracheostomy care. We are here to help you and your caregivers. Please be sure to ask questions and let us know if you have any concerns about caring for your tracheostomy. Thank you for watching.